Good afternoon, everyone. How are you? My name is Lynn Jennings. I'm Vice President for Grants Management at the Legal Services Corporation. Welcome to the Using Evaluation and Data-Driven Decision-Making to Improve Organizational Effectiveness session. So that's a whole mouthful. I'd like to introduce my new besties that I met through this process. To my right is Kelly Shaw Sutherland, and she is the Director of Research and Evaluation at Legal Aid of Nebraska. And to my left is Holly Stevens, who is the Director of Evaluation and Learning at the Children's Law Center, located in Washington, D.C. So we are going to have a little bit of interactive questioning throughout the session. So if you want to join Poll Everywhere, there are the instructions for you. I'll leave it up for a few minutes. And while I do that, I'll just review what our agenda is for today. So we're going to start out, I'm going to provide an overview of where the Legal Services Corporation has been in having LSC grantees collect outcomes data for their case services. So what that has looked like over the past several years. And then I'll turn it over to Kelly, who will talk about some work that she's been doing at Legal Aid of Nebraska with regard to outcomes collection and evaluation. And then we'll hand it over to Holly, and she will talk about what's going on in her neck of the woods. So is everybody on the text everywhere? Wait, Poll Everywhere. Poll Everywhere. Okay. There's our agenda. Okay. LSC outcomes tracking requirement. I was thinking about this, and it made me think of the movie, which probably half of you haven't heard of, What About Bob? Baby Steps. So, and if you haven't seen it, it's very good. It's got Bill Murray and Richard Dreyfuss in it. And so I started at LSC in 2012, and when I arrived, because I came from the policy arena, I had worked at the Department of Labor, and I had worked at the Agency for International Development, and it was all about outcomes collection. How can you demonstrate your impact? If you wanted more money from Congress or the Office of Management and Budget through the President's budget, how are you demonstrating your impact? So I got to LSC and I said, okay, so what data do we collect? How do we demonstrate our impact? And then I was introduced to the Grantee Activity Report. And I thought, well, this is a whole lot of data, but it's a whole lot of output data and not a lot of outcome data that we collect. And then Jim Sandman oriented me to the fact that we had just gotten a grant from the Public Welfare Foundation, and that we were slowly introducing the concept of outcomes collection for data services, for case services, and it was a slow educational process for a lot of our grantees. And but not for all of our grantees, because the states of Texas, New York, and Virginia had for quite some time required outcomes collection in their, for their funding from their IOLTA programs. So we started in 2016 in the application year for grantees to start collecting outcomes data. And then in 2017, during the grant application cycle, grantees had to confirm that they were collecting outcomes data in extended service cases. And by 2018, then grantees had to provide a narrative of how they were using their outcomes data. And then that was just a little too qualitative for us. We weren't getting enough data from our data collection questions. So we started with some very comprehensive charts on the applications for 2019 and 2020 for you to let us know if you're collecting outcomes, how you're using them, how you collect them, and so I'm going to share with you the results of those. So as you can see from the chart above, and this is based on service area, not grantee, and I'd like to thank Sarah Abdul-Hadi, who is in the Office of Data Governance and Analysis, who put all of this information together. So as you can see, the vast majority of LSC grantees of grantees now collect outcomes data. And you see that about 82% collect them for limited and extended services. 15% are, almost 16% are extended only. And 3 of our grantees, that's not service areas, but 3 of our grantees aren't collecting any data at all. And we'll be dealing with them separately. And the kind of outcomes that they're collecting, we break it down into financial and non-financial data. So the non-financial outcomes would be, did you get a divorce decree, a civil protection order, that type of thing. So it was, what was the result of the representation, either financially or non-financially? And of course, the financial data speaks for itself. So again, a good percentage, because they have to be collecting outcomes data. We're at 91% of service areas are collecting those data. 7.3% are collecting non-financial only. And again, our 3 that are not doing anything and are in trouble. So next is we asked about methods for collecting outcome data for both extended and limited services cases. So you can see we have 2 charts like this that are interesting but hard to read. So I put them in chart form so you could see that the overwhelming majority of our grantees collect their outcomes data through their case management system, but they also employ other methodologies as well, such as mail-in surveys, checking court documents, follow-up phone calls, and client satisfaction online surveys. But overwhelmingly, it is the case management system that captures most of this data. Any questions? No? Okay, keep going. And then we also ask how frequently programs are reviewing their data, because there's no sense collecting it if you're not looking at it or reviewing it on a regular basis. And it appears that quarterly and monthly are the most utilized timeframes for that, and weekly is the least popular, and ad hoc comes in third. So it's good to note that a majority are doing it on a regular basis, and so we were happy to see this. I do think that, you know, from my vantage point, I think maybe these numbers are a little inflated. I'm not sure. It's hard for us to dig down deeper until we go out on site and see how people are actually using it. But we are heartened by the fact that so many grantees are collecting data, and next we get to how they're using the data. So we also provide several options for people to choose about how they're using their data, and I provided the top elements of that, and they are primarily, as you can see, for tracking and setting organizational goals is a big use. Evaluating resource allocation, which is good. Fundraising is something that particularly other funders, not necessarily LFC, but if you get money from a private funder, they're all about outcomes these days. So it's good that you're doing that for fundraising, as well as basing decisions of level of service on a particular case type with the outcome data, identifying shifts in program priorities, and assessing staff performance. When we first started and embarked upon our baby step philosophy, there was a lot of concern among the grantees that the use of outcome data would be used against them, that maybe we were tracking failures or certain things weren't working out. But in fact, it makes a program stronger when you're able to reflect and assess through data, and not just qualitative data, but quantitative data, about how you are impacting your clients, impacting the community at large. And so we are finding that grantees are employing data in a number of ways, and we are heartened to see it. I know that there are different levels of sophistication among our grantees on this still, and we have staffed up our training and technical assistance. And Carlos's group, the Office of Data Governance and Analysis, is also very interested in this. So we'll be providing more training and technical assistance on this in the future. So that is my presentation, and now I'm going to hand it over to Kelly, and she's going to get us started with the poll anywhere, everywhere, anywhere, everywhere, wherever you want to go.
Is it, do I have this the right way? Like that?
Yeah,
Okay.
it's good. You go down.
Okay. Hi, I'm Kelly Shaw Sutherland. Before I kind of delve into what I'm going to really talk about, we're showing you this, and then I want you to take a look and put in where you think your organization is at based off of the explanations down there. Let's see, am I doing this right? Okay. Well, there you go. Right on. Okay. That's what I like to see. Oh, we got some fluctuation. I'll give you a little bit, I guess.
So there's data denial.
Yep, so we're talking about data denial, data indifference, being data informed or being data driven. I think what we want is we want to be data driven. I think most of us would agree with that. Even places where we have people like myself and Holly, we might sometimes vacillate depending on what the situation is. But it's not surprising to me where those numbers are at. But that's why we need to have these conversations and have more discussion about how to actually use data-driven decision-making. Like, what does that actually mean? It's a higher-level concept sometimes, and people, I talked about this a little bit at NLADA, and the question came up, well, what if you don't even know enough about data to even put yourself on that spectrum? And I think that that is a very real reality, not just in this space, but maybe in nonprofit space in general. So that, again, is another reason why we want to have this conversation. So what Holly and I are going to do is give you examples of our experiences doing this kind of work and how we're trying to use evaluation and data to drive organizational effectiveness. And it's not just collecting data and putting it in a shelf somewhere and never doing anything with it. How does that translate from things like your strategic plan all the way down to the survey that you develop with your program staff and et cetera, et cetera. So that's kind of where we're going with it.
Oh, look at that. Those are great results.
Oh, I love the honesty. Thanks, guys. Okay, so.
Don't trust data and avoid using it.
Oh, yeah.
It's a 6%.
It's not a bad thing. That's okay. Just maybe we can change your mind. So just before I kind of, tell you about Nebraska, can I just get real quick show of hands, who are our rural kind of programs? Right on. Okay, so that's kind of where I'm at. Nebraska is a very large geographic state. We have 93 counties. This is showing you the breakdown of those counties by rural and urban and the number of attorneys that we have in those counties. We have about 80 rural counties, about 32 of them are rural frontier, so we have less than 6 to 7 people per square mile, and that really has an impact on how people access. And so because of that, we have to maybe think a little bit more strategically and think a little bit more outside the box. I'm constantly asking questions when I go to sessions with others, questions about rural. How do we do this? How do we do this? Technology has to be involved in that in some way. And so to just kind of give you a little context, I come from the field of public health. I've only been with legal in this community for about 4.5 years. And I know there are solutions for this. I did a lot of rural health policy, program planning, program evaluation in that space, and I see so many similarities with the issues, and it can be accomplished. And in Nebraska, we're just starting to do some things to try to kind of get ahead of that issue, and so we'll hopefully be talking more about that in the future too. So let's see. Oh, well, the one thing I actually wanted to point out too was we actually have 12 counties in our state that don't have any attorneys, and we have 6 to 7 or we have 7 offices throughout the state, but if you know where I-80's at, that's mostly where our offices are kind of located. And so our service areas are these huge, kind of vast geographic areas, just as another heads up. Okay, so why is being data-driven and integrating evaluative thinking even important in the first place? Why is it necessary? So I'm sure you all have a mission statement. You have staff that want to do things to help. You want to do that so that you can improve your programs, or you want to use data and you want to be evaluative in your thinking in order to improve your program. So think about like quality improvement. We'll use my health background, I guess. QI programs are very prevalent in that space. But it's not just to increase your effectiveness or your impact, it's to increase your efficiency in the things that you do. So looking at your processes and looking at how you do things, from manual, data entry to automation to whatever, the more efficiencies you have in what you're doing can translate into potentially more people that you can serve, or maybe higher levels of service, depending on how you look at that data and how you, or the information you're collecting. It doesn't necessarily have to be a hard survey, closed-ended question or something like that. You can find the information out in a variety of ways, and Holly will talk a little bit more about that. But that, if we go over to where it says increase your organizational effectiveness, this translates into you being better at doing the work that you're trying to do. I constantly say, do you want to be as high quality as possible, or do you just want to kind of give sort of okay, service, but serve more people? That's, I think, the dynamic that we struggle with in this space. And it's a fine line. We don't want to leave people behind, but we also want to make sure that we're giving the most effective services that we can. So that's kind of, in terms of putting yourself into the competitive advantage, with LSC in the room, they're a funder, and that really helps them to go back to Congress and justify the funds that they are getting from Congress. And in that same vein, it helps us to justify to them in that way, and it's this kind of big feedback loop. So just kind of think about it that way, and we don't have to think about the funder as the enemy. They're there to help us. But I can say we are lucky in this regard. For those of you that are grantees with LSC, I haven't seen this level of technical assistance and help, so at least in my experience. So I think, we're very lucky in that respect.
She was not paid.
I was not, I promise. But I mean, I'm just because I had so much experience in the other side, it really is troubling to me at times. So, how do you do data-driven decision-making? I started to think about this after I talked about, I kind of had a little bit of this discussion last year at this conference about data-driven decision-making, but it was just kind of that one slide. So I started thinking about what does that look like, and how can we articulate some steps maybe, or a rubric of some kind. And so I went out and I kind of tried to find a whole bunch of things that might be helpful. This is just one example that I found, and I kind of modified it a little bit to make it make more sense for us. But I will upload the full document and everything to the Dropbox, but this just kind of gives us something to go off of for right now. So thinking about the dreaded objective, if you start with that, that will be, what kind of questions, what kinds of things are you trying to track or understand? And then you can make assumptions about that one way or the other. That way you can confirm or not. And this is where, Lynn was talking about failing is not bad. You want to be able to confirm whether or not something is working so that you know not to do it. And then, before you can do that, you want to make sure you're identifying whatever kind of data you need to be able to answer that question or hypothesis. Develop a process. Planning is so important. From the beginning of the time that you even begin thinking about your program or you're writing that grant, you need to be thinking about these things along with it. Because I've heard so many people talk about, and then we come back after the fact and we realize we didn't track that data, or we realize we didn't do this or that, and it makes it so much more difficult if you don't do that. And it's not like I've never done that. I have lots of times. And you can't know everything. You just have to keep trying. Then you know, kind of turn that into your data collection plan when you build the process, okay? And then you go out and you actually do the data collection and you analyze it. And then from there, you kind of make the decision. There's a lot of kind of other things maybe that you could identify in between, especially the data collection and the data analysis piece. I was talking to our data analyst about this, and she started going, well, in this, and this, and this, and this. And I was like, well, you're a data scientist. I don't know if that would maybe resonate so much. But there is, but this kind of gives you a general idea. So I want to kind of give you an example of what I had to do. So I'll talk about our client survey and outcomes a little bit. So when I first started 4.5 years ago, we had, I don't even know, I'm estimating about 15 to 20 different surveys that were sort of trying to get at the exact same thing. It was more satisfaction based, and it wasn't, I didn't find any questions that really tried to measure client knowledge or awareness or to try to see if we'd done anything beyond just the satisfaction. What does a client being satisfied with your services actually really mean without anything else to kind of help you out with it? So being cognizant of how you kind of develop those things. So, you know, the first thing I did, I went through this whole list, okay, and it's still a continuous process. What I ended up doing was it took probably from beginning to end a 2-year process originally, because I started and I would do a mini survey maybe and kind of try it out. And so we didn't actually officially launch this until January of 2018. And the key is we, because we're statewide and because we have so many different subpopulations, we knew that we needed to provide the ability to do this survey in a variety of mechanisms. So we built into our case management system the ability to download a mail version of the survey that actually prints the associated case number for that person's case at the bottom. We have a in-person version where you write the case number in, if the staff person will. And we also do it electronically via SurveyMonkey. I keep saying the case number because we take that case number and we merge it back. We take all that data from the SurveyMonkey, is what we use, and we link it back to all of our case management data so that I can create groups and compare through the different demographics and or the different levels of service to try to drill down the data a little bit to try to understand a little bit more about our clients and why they're saying the things that they did. So in 2018, we got about 1,311 surveys back. Before you get too excited, that's only around 16 to 20%. But it's still a good enough amount that if we keep doing that consistently year over year, we'll be able to pool the data together and maybe find some more interesting insights. We have one more survey we're just trying to, from 2019 to close out, and we're on track to probably get more than we did last year. And there is an entire process related to how that works, and there's a compliance aspect built into it, and every month I look at this stuff and I go back to the staff. If they go up or down in a certain amount of cases not being marked in our case management system, then we have a conversation, right? But I didn't have to do that very much after the first 6 months. So, I mean, occasionally I might have to go back to somebody, and it's usually because we have somebody that's new. So that's why, I mean, you can't just one and done it. You have to constantly keep on top of this stuff, which can be a little difficult sometimes when you're one person. Yes.
Oh, somebody else? No, I had a question. Oh, yeah, it's me.
Right on.
So what are the conclusions that you've drawn from your surveys?
All right, well,
Am I
glad
getting
you
it?
asked that. We just started kind of doing the analysis, and I get a little scared to share this with you guys because I know at least with our staff, it can be somewhat of a touchy subject. So just before I start explaining this, I'm not saying that advice and counsel is bad, okay? We asked the question to clients about before, and they have to do it retrospectively because we can't do real pre-post surveys, at least realistically or feasibly. So we ask retrospective pre-post questions, thinking before you came to us for services, where were you at in terms of your confidence in your ability to understand your legal rights, to understand your legal case, how you make, your ability to make informed decisions, and your progress in your case or your understanding of it, and whether or not you're prepared for court. And the interesting thing that we have found is that there is a statistical difference between advice and counsel level cases and brief service or limited scope cases, and there's also a difference between advice and counsel and extensive extended rep cases. What that means, at least for us, at least what we've kind of deduced from looking at this, is that people want to actually either talk to somebody or on the phone or in person, meaning an attorney. And we have a unified intake system where our staff actually give clients advice, but they're paralegals that discuss with our access line attorneys and then pass it through. And so we're in the process of trying to look at this data to understand, is that really how we want to continue? Is that the best way to do it? We're a long way from actually making a change like that, because it's not like something like that goes overnight. And it doesn't mean that we have to actually do that, but maybe we can do things a little bit differently. And so using this data is what's kind of driving us to even begin to have that conversation. And that's what we mean by data-driven in a way. And we wanted to ask a question about whether or not this is working. It kind of happened maybe a little bit backwards because we formed this survey, and because of the way that we did it and the way I was able to connect it back to our case management system, I'm able to parse it out in that way. Does that kind of answer what you're talking about? But the other thing about this is that's very limited. This is self-reported client information, and so we needed to go a little bit a step further. What's happening on the cases, okay? And so that's when we started to kind of think. We kind of started to think about it prior to, but case outcomes, okay? So when Lynn's talking about outcomes, I always stress their case outcomes. They're your short-term outcomes. They're not necessarily what happened to the client years down the road or something like that. So I just think it helps to kind of keep it clear that way. At least it helps with our staff anyways, to kind of keep it set up that way. And so the case outcomes we just started doing last year. And we just had our first year. We worked with Rachel Perry. It was a situation where I couldn't do it all on my own. I tried to for kind of a year, and my workload between that and just trying to get staff to even have the conversation with me was kind of difficult. And even though I have their trust, I feel like at this point, it was still difficult. And so needing to have that outside objective person to come in and kind of get the ball rolling. Once it did, it took us about 6 months. We developed it. We had an internal person help us revise our case management system into a outcomes kind of tab on PICA, which is what we use. And so we've actually just closed out, and we have our staff get sent. Well, theoretically, they're supposed to do it monthly. We're still working on it because
so
part of
monthly, but maybe not so much.
Right, but the plan is moving forward, because part of it is we couldn't necessarily do it monthly, at least from the get-go, because the process was really still being kind of developed. But the goal is monthly, because what that does is it gives them a set number of cases that isn't our gargantuan amount that they have to go through. And really all it is did they mark them correctly, okay? They're marking unsuccessful, successful, or not applicable. And we can talk about the fail stuff in a minute. Am I good on time, guys? I want to make sure that I'm good. Okay. All right. So after this first year, we realized about $18 million in total financial impact for Nebraska, which sounds amazing, and it kind of is, and it also sounds kind of abstract. And what that really means is $3 million in increased assets. It means $3.8 million in increased income and $11.1 million in decreased debt. And that's because we had a couple of bankruptcy cases in there that are not probably always going to be there. Just kind of those situations, but still very cool. That means that it's about $32,000 on average per case that we can realize. If you wanted to break that out into lump sum back awards, it's about $981,000 that people have gotten in that kind of frame. Or it's about $206,000 in ongoing monthly benefits that we were able to accumulate. I think there was over like 400 days of extra days that people got to stay in their housing as well before they actually had to move. And so we're looking at those non-monetary things as well, and the next step is to try to drill down into that on the outcomes underneath our priority areas. We have 4 priority areas, and all of it is built under those. And so we have outcomes that might cross certain areas. And so we need to, because we're just closing out, we're going to start doing more analysis on that. And so hopefully I'll be able to kind of keep you guys posted on that stuff. I don't know. Oh. And Holly, you might be able to talk with me about this a little bit, but we just want to stress, I'm going to go the wrong way. You've heard it a little bit here, but the idea of failing forward, really, you have to fail in order to learn about whether or not something works, and you have to be unafraid of talking about it. I know that might be a little bit hard.
With LSC in the room.
With LSC in the room, or maybe for high-performing, overachieving attorneys, I get it. I don't know, I kind of think if I didn't learn from my past way I've done things, then I would never be able to change the way I've done things, to improve, to understand how things work or why they don't. And it's just, I cannot stress enough how important this is. And I think, the stuff that I've been talking about are an example of, looking at how a plethora of different surveys does not work. It's just a drain on one person's time. You can't manage it. It's not feasible. So, I think communication is key about it. You need to talk to, within your organizations and across your organizations. Hey, we tried this and it didn't work. So just like the gal at lunch was talking about, go her, I totally appreciate that. So, yeah. Sure.
So attached the case number into survey, right? So like, we're not really saying anonymous.
No, we don't. And so that's a great question. So she's asking about whether or not we say it's an anonymous survey. What we do say is that your information is going to be grouped instead of, and not in the aggregate, because we felt that people didn't necessarily like that word as much or didn't get it, but to understand that we're never going to share their individual survey information with anyone outside of our organization. And generally, it's just myself and the data analyst who are looking at the raw numbers anyways, so. Well, so that's also a great question. So she's asking about how we data enter the surveys, and is that, I'm assuming you're talking about back into our case management system. Yeah, so that links in. So when I'm talking about linking the data back, we use SurveyMonkey. And I actually use SurveyMonkey for the electronic version, the emailed version, but I recreated the survey for data entry purposes. Our paralegals on downtime actually enter all paper surveys that we get back. And the case number, the reason that's there is because when you have 2 data sets, I'll try to say it shortly here, I guess. You've got 2 data sets, you need a unique identifier to link them together, right? Not so that you create multiple more rows of data, but so that you can take data for the same person that maybe has different columns or whatever. And we do it outside. It's not in the case management system, okay? And so I use Tableau to connect a lot of things. I also use SPSS. My analyst uses R. And we've been trying to play with ArcGIS as well. But you pull the stuff out of your case management system, or we link directly using SPSS, R, and Tableau. So we have a backup version of our database. It's built on a relational database, so SQL. And so these programs that I'm talking about, that's how they link up, basically. I mean, we can talk more about it, but.
Yes.
So let's get to the next question.
Yeah.
And get out your phones. The next question is, and then we're going to move to Holly. And one of the things that we want to talk about is what investment does everyone make in terms of dedicated staff for data and evaluation? Is it, and based on FTE, is it less than one FTE, 2 FTEs, more than 2 FTE? So, an FTE, because we have a war on acronyms at LSC, is full-time equivalent. I should say that, because if not, Jim Sandman will fire me. Oh. That's interesting.
Yeah, that is.
It's,
I would like to meet all those people.
that's great, yeah. There should be an affinity group for the data people. Well, there was the big data session, so. So,
Yeah.
So
excellent.
By data and evaluation, so just to clarify for them, are you talking about, like, there are some tech people who get lumped in with that, but there's also program management is different than data and evaluation. So which one are you aiming for on that?
I mean, Holly.
Anybody who's doing kind of data reporting would probably be a half time or less than, but it may not be dedicated time at all, right? So if you know, some people, you're right, they're tech people are doing any reporting for grants, but that's not really their, maybe it's part of their job, maybe it's not really part of their job, they've inherited it over time. I think that would be less than one.
You're up, Holly.
I'm up.
And,
Is it, can everybody hear me? Let me get a little.
no, you need your mic.
I need my mic. Okay. I'll get it closer. Now I have a clicker.
There you go.
Thank you. Oh, hi, everybody. I'm Holly Stevens from Children's Law Center. And Children's Law Center is in Washington, D.C. We are not LSC funded, so I have a lot of freedom up here to say whatever, I guess, about data. Uh-oh. I think we have an old version of the slide deck here. Uh-oh.
The mic is not.
Oh,
Okay.
That is an old version.
Yep. We don't have the right slides.
oh.
Okay. We'll go with this. We have some different slides that I want to show you. But we'll see how this goes. So Children's Law Center, we have a timeline and all kinds of good things. But Children's Law Center, we represent children and families in Washington, D.C., low income, everyone, and we have lots of practice groups. So we have a guardian ad litem practice group. We're the institutional, GAL, for Washington, D.C. We also have a large pro bono practice where we're handling over 500 cases with pro bono. We kind of have affirmative mentorship on all of those cases. Then we have one of the largest MLPs, medical legal partnerships, in the country. That's with 3 medical partners, and that represents children who are experiencing difficulties with special education, access to health care issues, kind of denials, healthcare or health harming housing conditions. So if you have housing conditions like mold, things like that, not evictions, but accommodations for other kind of issues in your home, and public benefits. And then we have kind of a little bit, we dabble in some family law kind of work with our pro bono practice that we do take some very complex cases in-house. So just to kind of give you kind of a setup of what kind of work that we're handling. We also have a very supportive board and leadership team around data and evaluation. And so we're missing kind of a timeline here, but I just want to say that that is an active choice. We are very lucky. We have a large team at Children's Law Center that's dedicated to data and evaluation that's grown over time. So in 2008, we started with an external consultant. Many of you have probably worked them with your grants, kind of short-term process. This grant, or this consultant wasn't through a grant, it was just kind of allocated in our budget, and we worked with them for about 1.5 years. This was before I was there. And really thought about program design thought this consultant was going to come in and really be able to dig into program evaluation, jump right in. But of course, as they dug in, kind of thinking about what you do and how it leads to program outcomes became kind of the question. What's the program design look like and what's happening? So in a year and a half later, they hired me as the first full-time staff member. 2 years later, we got an extra staff member. We then had another staff member. And now we have 3.5 FTE for data and evaluation. So some of what I'm presenting, and we'll have some prettier and more fun slides online for you later, but I want to just, disclaimer, we have a lot of people who are helping us do some of this work. So some of the sophisticated analysis and data things that we can talk about require that kind of an investment. And it is at the expense of less attorneys. So let's just say that out loud. The decision is to hire different people to do this in the hopes that we would be able to compel other kinds of investment and funding later on. And I will say that's already happening. So we have a number of grants and a number of the first outcome-based contract for legal services that is now kind of supplementing our funding because we have this capacity in data and evaluation. So don't everybody hate me. We do have a big team, and that's how we get this done. And I think the more you have a data person, the more data people you want. I want more of them already. So I do. I'm trying to compel. Yeah. So I just want to also lay this out there. There's not one way. We're not going to talk about RCTs all day. We're not ready for them. Most of you are not.
RCT is?
A randomized control trial.
War on acronyms.
War on acronyms. We are not going to just talk about randomized control trials and sophisticated methodological analysis here. That's not what we're doing. There's room for everyone here. There's room for qualitative analysis, quantitative analysis, meta-analysis, and we're going to need all of those kinds of data to move the access to justice field forward. So we are not going to kind of have a debate on whether qualitative or quantitative better, whether we're doing participatory evaluation, all of the kinds of things that sometimes people get wrapped up in. We don't want to do that, right? Everyone is welcome here. Storytelling, all of the good stuff here that we need. We also want to involve more clients and communities. So we are very new to the feedback loops. Listen for Good is a grant provider that if you're interested in kind of starting off small and collecting data from your clients on outcomes, we did this with our brief assistance matters. We surveyed them to find out if the brief assistance and brief service was effective. Did it resolve their problems? Were the referrals that we were providing, did they contact those people? Did they help? So things like that. Listen for Good, though, all about constituents and improving your process and building in those feedback loops that a lot of the tech companies and the tech designers and product designers have been talking about at the conference, right? That evaluative process of continuous learning that we're not all familiar with in gathering that information. So really involving those constituents. And I really hope those people that have the data, staff, that we can begin standardizing across all of our practices in terms of the outcomes, in terms of the way that we collect information. We do a pro bono case closing survey. We want to share that. We want to be able to help one another. We don't need to recreate the wheel here, and have a better learning community around data and evaluation in legal services. So moving from inputs to outcomes, this is not going to be the most exciting part of the presentation. I'm sure all of you have used logic models in the past. You may hate them, right? They are these things that you need to fill out for funders that don't help you do your work. I'm going to tell you that you're wrong. We're going to move you to the dark side of loving logic models, or at least maybe not disliking them so much. So moving from inputs are all the resources that you're putting into things. Activities are what you're doing, legal representation, and we'll talk about why that's not enough in a minute. Outputs, numbers, number of cases, number of people helped, those kinds of things. And then the outcomes, short-term outcomes, intermediate, and long-term outcomes. You in your project are only responsible up to those short-term outcomes. That's a case outcome, right? That is what you can control in your offices, that you can control your representation, your model of representation, and how it can lead to better outcomes at the end of the case. But that's not always why we do our work, right? That we're not just doing it to win cases. We're doing it for something else. A lot of organizations haven't thought and kind of written that down, right? And created a logic model to say, why am I doing this work? We get a lot of calls for assistance and kind of technical assistance after we talk to people like yourselves and say, well, we're trying to eliminate poverty. And if you are trying to eliminate poverty in your community by doing legal services, that is a big leap from your legal services and kind of your theory of change, how we're going to get there, may not be likely. You may not achieve those goals. So what is likely? What is the means to an end? To what end are we doing this work? And how do we know we aren't doing harm, right? How do we know that just giving someone a lawyer, there's lots of studies that there's kind of unintended consequences, right? And so we really need to be asking those questions and thinking more about that. So this is our logic model for Healthy Together. You can't read this, pretty small font, but this is the cleanest version that we can get for a presentation, right? So you can imagine what the first versions of this looked like. This also does not have how we measure things, right? Secure educational meaningful education, those kinds of words on there, those are hard to define. You can't do it on a chart. We need underlying documents that really give us the definitions of what do we mean by a meaningful education? What does that mean to us? And how are we going to measure it? What are the indicators of these things? So this logic model is actually nested within a theory of change, within our annual planning, within our kind of other grant goals, and then within these definitions and our evaluation plans of how we're going to do this. How are we going to evaluate this progress? And so we do collect outcome information at the end of the case. We also survey, interview, call, we'll do anything to get you to continue to talk with us in kind of a longitudinal way. So we have interview data from our medical legal partnership. This is the logic model from our medical legal partnership at 30 days post-case closure, 6 months, 12 months, 18 months, 24 months, and as long as we can keep you in touch with you. Wow. We do give grocery cards, a $20 grocery card for participating in interviews. So, and I will say it used to be a census. We were not sampling. Our program has now gotten too big, so we have a pause, and then we're reflecting now. We'll start our sampling and start doing interviews again. Actually, about 3 months from now, we'll start again. In addition, we share data with other partners, and we collect their data from them. So we have data from MCOs, managed care organizations, insurance agencies, to see if our cases and our medical legal partnerships is impacting healthcare outcomes. So healthcare expenditures, we get claims data from our MCO partners to find out, are they going to the ER less? Are they going to the hospital less? Are we increasing mental health care, which is what we want? We don't want you spending less on that. We need you to spend more. That's some of the goals for our managed care organizations in DC. Are we increasing primary care use? Those kinds of questions. The years that it took to set up those data sharing arrangements and things like that are tremendous, and if I think about them, we're going to have a trauma and therapy session for me. But I tell you that because it's possible, right? And so I want you to think big, but start small, but know that these things can get done. And we're going to look at some of that fun data about how much we're saving in costs that just got done. But when you start, we had all of these fits and starts. We're going to do all this stuff, then we would see we're doing something wrong. Learning to fail is probably the most important thing. Being vulnerable. Get ready to be just uncomfortable a lot. Our staff are uncomfortable every time I have a meeting with them, right? I'm always asking them, what are you doing? How are you doing it? Providing representation isn't an activity. If you get to the end of this study and you say, oh my gosh, your outcomes are fantastic, how did you do it? And you don't know, it's really hard to replicate that. It's really hard to go to someone and say, well, we provided a lawyer. What does that mean? What is the model of representation, right? That's hard. That's hard for lawyers to say, oh, what would I do? I'm a lawyer. Drawing that out in meetings and really asking questions and writing down the roadmaps of what they think are the indicators of a good case, of good representation, and then having that data in your system to pull out and check compliance is really what we need to kind of look at whether these outcomes line up with the program model. And our Guardian Ad Litem program model, it's a long explanation of what teaming is. What do we think teaming is for us and for our medical legal partnership? What is medical training for people? What does that mean? All of these things. So this does kind of give us a guide of where we are and then those underlying documents. For you all, we kind of started a memo. We said, here is our philosophical stance on what evaluation and learning is at Children's Law Center. Here's why we think it's important. Here's why we think staff should feel like it's important. And here's a plan that we're going to roll out so that we can do these logic models and these activities, really these program design models with every department, every program that we have at CLC, even our non-case handling departments. That has different activity sheets and worksheets. And so I'm happy to share those if you all want to use them to kind of have a meeting. The first one is about purpose and outcomes. So getting all of your staff in the room to really say, what is the purpose? What outcomes are you trying to achieve? And pushing back, to what end? Is that a means to an end or is that an end? Even just last week, I had a conversation with social workers and really pushing back on, is that the outcome or is that the outcome to get to something else? Is that a short term? Is that an intermediate? Is that why we're in the case? Some kinds of questions that are tough to answer and feel tedious, feel very much like you're having a conversation with a toddler. Why? Why are you doing that? Why are you doing that? How are you doing that? Things like that. Then we have a worksheet and kind of an activity around activities and the program design. We have a theory of change and logic model session that then we build. Then we have step 5, evaluation of the program implementation. Then we have an evaluation model for impact. And finally, we have kind of this continuous learning cycle that we're building in throughout, right? And this compliance. Soon now we'll have kind of monitoring plans built in and supervision plans, but just to say, like, this is the kind of planning that I wish we had done up front. It's really hard to then go back and be doing some of this in between and fits and starts. And so anytime that we can save you to start in a way, if you have a new program starting, if you're starting a new area of law that you're working within, these kinds of things at the beginning will set you up to be so much more successful and have the data that could be helpful to show funders and things like that. So we use our data in so many ways, right? We're using it all the time. But 2 things to streamline our process. A lot of process analysis here. So we decreased intake time from our intake analysis. We also are making better informed choices through our screening process and our intake process. What is a good brief service versus a brief advice? What are the characteristics when you're in an intake to choose one or the other? What does that mean? What does that look like? We're testing our ability to make those decisions. We identify high priority cases and flag them and monitor them in different ways. And then we also continue the kind of what I like to call promising practices. So sometimes we find some things that one attorney is doing or 3 attorneys are doing. And a couple years ago, we had attorneys who were really invested in providing what we now call and kind of rolled out as client advocacy training. They're just really good at it. And their clients would either come back less often. In the interviews, their stickiness of their legal outcomes is longer, or when they come back to us, they're more prepared. We don't have to do as long of an investigation. So some of that work is already done. In the pilot, our analysis is showing that those are statistically significant differences with those attorneys. So we rolled out an entire training program through all of our clients that a lot of our leadership thinks that's not going to matter. In DC, you need a lawyer. Advocacy training, we shouldn't spend time on that. And now, in fact, we have a lot of research that backs up that this advocacy training that our lawyers are providing in each extended representation case is helping them sustain legal outcomes longer. They're coming back less often, less frequently to us. And again, same as the pilot was showing, that they're better prepared, that they have all of this documentation from letters when they wrote to the landlord, when they called. They've done some of that investigation work up for us, so we don't need to do it. So we're saving time, right? Everyone's surprised by this, and now all of our leadership kind of bought in, and we have this kind of embedded into the medical legal partnership model. So it's one thing that's pretty surprising, right? The unexpected findings here. But when we're looking at that cost avoidance study, I wanted to say that this is where we're building investment and support in new and interesting ways, right? We have a pro bono evaluation. That's built a lot of support around our pro bono work. I've presented on that other places, but if people have questions, we can certainly talk about that. And Some of that has really helped the firms know what they're getting, that we're training their lawyers on litigation skills, that they're improving outcomes too for clients. What kinds of cases do better in a pro bono situation? How do we flag those? So some of that work is making our pro bono investment, building better partnerships with new firms and things like that. And then we have this one, this cost avoidance study, which is trying to determine whether a medical legal partnership is actually improving health, right, with our MCOs that we talked about. So this is just done. This study was just completed. It's ongoing. We'll be continuing data collection throughout the process. We'll share data for as long as the MCOs will participate with us. But this is a 3-year period. There's over 3,500 kids during that time. 2 MCOs, 2 managed care organizations participating, and that covers over 60%, or almost, well, now it's about 62% because AmeriHealth, one of our largest MCOs, is covering more kids, but at the time, I think 57 over there. This is a map, so we map all of our clients. We've moved case management systems. We now use Legal Server, and so that all of our addresses are geocoded, and we put them into Tableau, we put them into ArcView. We're doing different things to hotspot and look at trends differently. But this is a map, and if I showed you a map of poverty and a map of ED, emergency department visits by rates of poverty, this map lines up almost perfect. In DC, we have a large group of children who go to the ER for asthma at a disproportionate rate, which many cities have. In DC, we see 1% of all emergency department visits at Children's National for children with asthma. That is, of course, not the number of children in DC. That's not a proportionate way. So we're seeing a disproportionate number of the emergency department visits. And healthcare providers care about this because it's driving up cost, right? So anything we can do to help save money and improve children's health. So from this analysis, we know that this is for housing conditions cases with children with asthma. To be clear, we have this data for all legal problems and all children, all levels of service. This is brief service and extended representation. There were no differences when we segmented that, so this group is tied together. And you can see this is at 12 months and then 18 months. The drop at 18 months is over $10,000, okay? And this is good for a number of reasons, because $10,000 is nothing to sneeze at, but also the negotiated rates for emergency department visits is very low. So when I get a bill, if my child goes to the ER, it's very high. It's different when you're looking at the claims data for the Medicaid organizations. So this is a large number.
So this is how much the organization is saving.
That's how
The
much,
MC
that's right, the managed care
healthcare
organization,
facility.
right. We're avoiding costs, kind of soft savings here. So we're looking at it pre and post. So we're looking at a trend before compared to a trend after, assuming that if this intervention, medical legal partnership, hadn't been in place, that the trend would continue. There would be no reason, if the child's living in a home with mold, for that kind of pattern to stop. This is not a randomized control. This is that pre-post analysis. We do have a control group that's not large enough at the moment where there was a conflict of interest or the client did not want service after the intake, so that we can compare those people, but that group's not large enough to make an accurate comparison at the moment. If we take a look at the top 10%, like the super utilizers, that number jumps up to $60,000 at 18 months. So you can imagine that that's a very impressive number for an MCO to wonder. And I think the thing to think about here is that you all know that your work is impacting other systems, right? It's impacting healthcare systems. You're decreasing costs here. You are decreasing costs in the criminal justice system if you're avoiding people going into the system. Those are long-term costs that are harder to estimate. This is data that we have available, and it's making the right people end up paying for service, right? We want the MCOs to help invest that government money that they're getting into legal services because we're saving them money. That $10,000 they get to keep, right? That's not money that it's just sitting there in there.
And they got a lot of money through legislation over the last.
They are not hurting.
No.
But our managed care organization that we're going to talk about, AmeriHealth, they have now invested. So they're splitting the cost with us in a pilot for the $10,000. They're splitting it into $5,000. So we get $5,000 as the legal services provider if we have a successful outcome for an AmeriHealth patient. This is kind of a pay-for-success, outcome-based contract. It is not appropriate for every kind of legal problem. It is not appropriate for it to be your only source of income, right? It's not going to take over and pay for all of our budget or anything, but it is one way that we're adding to our budget and getting supplemental monies and being able to serve more people. So this is now made a priority in a lot more of our housing cases. It's building better partnerships with our medical legal partnership, and our Department of Healthcare is involved now to look at this. So we have another MCO, the second participating MCO with data sharing. We'll be talking to them about kind of the same type of contract. So this is just one way that I think data and evaluation, one, has changed some of our decision-making in our cases. It's changed how we look at cases. Housing cases are actually come back to us most often for a lot of reasons. You can't fix one apartment in a building and assume that the leak above the building, things like that. It's changed the way that we're thinking about larger litigation against an entire building to improve children's health. And it's improved some of the relationships that we have with grants, foundations, philanthropists, to try and figure out how we can compel bigger investments. So we have received a Build Health Challenge a couple of years in a row now. We have Build 2.0 that just wrapped up, and now we have Build 3.0, which is a large grant, and we wouldn't have it if we didn't have the ability to look at data and evaluation. There's a big component of data and evaluation in that grant. So I wanted to flag kind of in a best practices way, if you're not starting data and evaluation yet, you don't have the people on your staff, you're going to work on that. We're going to talk to you about some ways to do that. Start adding in the scripts on your intake and on your retainers to allow you to use that data so that you don't think about anonymous surveys. You can link them up. We do match all of ours. We push back a lot with Listen for Good, for example, wanted us to do an anonymous survey because they do tend to increase your response rate, but then we wouldn't know what level of service they received and what their legal problem was. Not always do our clients know that it was a brief service versus a brief
And they
advice.
won't describe it in the right way. That was one of the things that was on our surveys. They had them write in their legal problem, and it does not match up half of the time.
Yeah, so put that in. If you need any thoughts on scripts, we can certainly provide ours, but if you put in your retainer that you're using the data for quality improvement, that there's lessons to be learned from others who already do this work, but that will allow you to feel comfortable, and IRBs and other kind of people who may help you use that data in the future. So I think that's all I want to share with you for the moment.
Right.
And then we'll...
Well, I'd like to say, and we're going to ask about barriers the barriers that you find in dealing with data analysis, but I think that sort of the arc that we presented is, the baby step analogy. We started out in 2012, we want to educate people on this, and this is for the most part, not those in Texas, New York, and everything, and then how many of our grantees are now hiring folks like Kelly to build in and make it an integrated part of how they do their business, and then taking it to the next level with what the Children's Law Center is doing is having a whole team focused on that. And when I got to LFC, we had the Office of Information Management, and thinking that was not what we wanted, and now we have mostly we have Carlos and data folks that many times I don't understand what they're saying, but I know I need them because they can translate that for us. So we have Dan in the audience who's great, and Rania who's here, and they bring a whole set of skills that we need to do to be better at our business and to help you be better at your business. Because in the end, it is helping the client. If we can help more clients more efficiently and effectively and tell our stories better so that we can go out and get more resources, that's what it's all about. So as we wrap up and then open it up for questions, we have one last question for you on your phone.
There,
Oh.
there it is, right there.
Okay. So if there were one word for you to describe your office's barriers to increasing data and evaluation capacity, what is it?
That's not shocking.
staff time.
Staff and then It's hard to wear a lot of hats. It's hard to wear a lot of hats. I will say that.
Silos, no. It's very interesting.
Do we get to keep?
Yeah, we get to keep this.
Yeah.
Right, Jennifer? She left, see? She thought she was free. Low priority. So let's talk a little bit, and you have a couple more things to wrap up. But before that, if you guys could address any resistance that you had to deal with as this plays out, because I know that staff time and resources, I had a colleague who used to say, you have to go slow to go fast, right? So it's stopping what you're doing and being more, and I'm guilty of this, every day when you get to the office is a game of whack-a-mole. What came up? What do I have to do? What is that? And it's really hard to step back and say, I need to plan this out. I need a project plan. I need to say, these are the deliverables, this is when we're doing it, what do we need to measure it, and everything else. And that, I think, the tyranny of the day is always something that we fight against, and particularly when you're on the front lines and you have clients that need your help, it is hard to have the discipline to step back and say, this is what we need to do to be more effective. Kate, do you have a question?
Well, I just have a comment. I mean, I think that at my program, obviously it's a time issue, but I think also it's a cultural thing, and like, you're going to use this data to fire me. You're going to use this data to show that I'm not performing the way that I'm supposed to be performing. So I don't want to give you something that's going to work me out of the job.
I absolutely understand that. And in talking about the way that we developed our outcomes, one of the things, and I know it seems like this wouldn't be enough, but one of the things that I cannot stress enough is in order to kind of get over that hurdle is if you do hire internal staff, or even if you're working with external staff, the trust you need to build with those people in order to do that work, and the leadership need to stress as well that this is not a result of, will not, necessarily be a performance review type of thing. But let's be clear, we also want to understand when something is not working. And if it's not working because, attorney A is doing approach, this way for a particular case, and attorney B is doing it this way, and maybe they're more successful, we want to understand why. We don't want to chastise you or fire you. We want to see where we're going to be the most successful. Does that kind of, yeah.
And in fact, I was surprised when we looked at the uses that I think it was 60% of grantees use the outcomes data in their evaluations of staff. Now, I think that that's just an element of it. It's not like wins or losses or things like that. There is one, I don't want to say extreme case, but one case where there is Utah Legal Services uses, also tracks time and how long people spend on, they use the 1635 timekeeping to measure the length of time. So it gives them a benchmark. Well, if I'm doing a simple divorce, if you're doing simple divorce, how long is that taking? And is that a good investment of time? So that adds another variable or element to your looking at performance. But I think that we have to understand that everybody's accountable. When they show up, it's called work for a reason, right? So it's not called fun. So you're there to represent clients, and I need to know how you're performing, and tracking your outcomes is just one way, but it doesn't mean that you have to be successful at it. I think it was Larry Harley, who was executive director of Southwest Legal Services in Virginia, and he said, we know we lose a lot of eviction cases, but we're not going to take those just because the outcome isn't what we like. Our clients need us to get us that extra day or something else, so that there is a means to an end there, even though the ultimate short-term outcome of that case is an eviction. So As Holly was saying, it's not one size fits all. There is a method to it and a rationale behind it, but you need to understand what you're looking at, and that's the reason to collect the data. But the resistance can be there.
Well, and I think that framing it also more as part of their development plan rather than a discipline.
Right,
Like,
right.
We're looking at, you're a brand new attorney, so we're thinking these are the types of cases you should be handling, this is how many, but as you're now 5 years in, this is what we're going to be looking at.
That's
So-
what we're kind of working
Yeah.
towards. It's
Right.
not fully in place, but the idea, yeah.
Yeah.
And I would say just being able to ask those questions, right? We have these roadmaps of how something's supposed to go. There's a lot of times it doesn't go that way. As long as you make note of that so that we know why we're making that choice. Maybe we're always going to take those cases, even we know they're always a loser case. But we're going to take them as long as we know why we're taking them. And that's an active choice and we just didn't let it happen for no reason. That's the part that you want to get to, right? Is that this was a choice. This wasn't something that, oh,
We've always done it that way.
yeah, we just take every case that comes through. There's different decision-making here, and I think that the culture piece is the biggest piece. It's the biggest hurdle. The accountability, and thinking about how we onboard people now, kind of in thinking about giving them the tools to start thinking about this from day one. What does the onboarding look like? What does the training of a supervisor look like? Not everyone in legal services is going to be someone who wants to be in a culture of accountability and in a data-driven office. That's fine. You just can't work with us, right? There are other places for you, I am sure. But it does become difficult conversations. It's funny when we talk about this yesterday, we were talking about this, that our supervisors had a book club last year to read Daring to Lead and Radical Candor. They need to be better about having difficult conversations, to hold people accountable to something that's uncomfortable, but it is work. And if understanding that we're trying something new, we're going to fail a lot. We still need you to try this so we can test it out to see if we can do better, to make better decisions, to do better for the clients. That's why you're here. All of our staff are mission driven. They care about their clients. They care about doing well. So let's just do it so that we can do better for them. I did want to share it with you guys, a free resource. Leap of Reason is a very easy, accessible book to start. If you haven't seen this, you can order it online. We give it to all of our board members. We give it to all of our new supervisors. We make them read it. It kind of sets up why a culture of data and accountability is important. They also have something called the Performance Imperative online. It's all free resources where you can kind of take an assessment and see where you are. It's time intensive, but if you're trying to figure out where to spend resources in terms of do I need to get my board on, my leadership is not on board, my board doesn't care about these things. There's different kind of activities and information to help move you forward in becoming a performance-driven organization. And this book is really accessible. I think it really helps people be like, ooh, that's where we want to head. That's where we want to get to. And it gives people all a shared language to talk about evaluation and data and managing to outcomes, which is how we say it now. We actually rarely call it evaluation in our office because people do automatically go to personnel evaluations. If that's the only way you've talked about evaluation in your office for 30 years, it's annual evaluation time. Of course, when we start talking about evaluation, they're going to attribute it to themselves. So thinking about that shared language and being purposeful about building that culture. I go back to the planning and kind of being intentional. It is exhausting sometimes to think those things through, but it does save you time on the back end.
Any other questions out there? Lee, did you have a question?
Well, the idea about failing, purposefully failing, and then what does that actually look like as an organization, and then putting that side by side with accountability, because accepting an organization, what that looks like is applauding the failures, right? It's publicly acknowledging, it's awesome that you tried this and it didn't work, and what did we learn from that and what's next? But then to put that side by side on performance and accountability, it's an interesting challenge to create both of those accountabilities exist in the same space where people understand when they can fail and when it's not okay to fail.
That's why we purposely do not make case outcomes a part of our performance. We were very intentional. We did not want staff to not mark their cases, in the right way, or maybe, I don't know, be as not that they would be dishonest, but we would have probably gotten way, way more pushback. And actually, when we started on that journey, that was one of the first, kind of explosive kinds of reactions that we got. And I should have said this earlier, it's not something that you say once and staff will buy into. You have to say it over and over and over and over again. And then you have to have the people that have been there for a while who have, oh yeah. Then when you get the new people in there, they are better integrated, I think, more quickly because then it becomes part of your organization. It becomes part of your culture. We're not quite to that point where, we just have only been doing it for a year. So I'm so jealous of where she is. And
I would say it never gets easier, and I
No.
think you're right. The two things, one, winning and losing is not in our individual performance metrics either, right? You are failing or succeeding at a larger level, and it's never the hope that we fail. We're trying something new that we think is going to work, right? We're putting in plans that we hope will lead to other outcomes. We just know not all of them are going to work or will be feasible. And so you're right, though, in terms of kind of morale of the office, of knowing that you were working so hard at trying something new or being held accountable to something and buy-in, and then it doesn't work, is very real. I think also even how we've talked about failure in the past is probably a failure on us.
Yeah.
Not even in this office, but in this room, in my office, we did kind of talk about it flippantly, like we're talking about this. But it is very hard for an attorney to sit there and say, I walk in knowing that I'm going to fail a family that I'm working with for a year. How disrespectful to kind of think about that. We all should be willing to fail and learn from our mistakes. But those mistakes have very real consequences for the families that we're working with. And so really thinking about how to message that we need to be okay, that we're not always going to get to where we want to be, but also in a respectful way that we're not minimizing the actual impact on actual people that trying new things has. There's no good answer, but
But that's why you have to keep working at it,
Right.
too, at the same time.
Listen, this is, I have gone to NLADA, EJC, I know, I'm using acronyms, but those are widely known here, and this conference, and I have moderated and spoken to outcomes and evaluation a number of times, and we will continue to be talking about it because we cannot get away from the fact that people want to know how we use our money, what are we getting for the investment, and how are clients being served and helped. Because ultimately, we know many of your long-term goals is to alleviate poverty in some way, shape, or form. And so that is a huge, if somebody had come up with that a while ago, we would have figured it out and everybody would be copying it, but we don't. It's a long slog. And so dealing with evaluation, finding things that work, tracking the data, that is where we are, and we will continue to have this conversation and share best practices. So I would Kelly?
I'm just real fast. There are some flyers back there with this information on there, but this is a free tool or a free kind of process that myself, Rachel Perry is an independent consultant that I think that some of you have worked with, and April Facelaker from the Harvard A to J Lab. What we do is we pair organizations with 2 to 3 evaluators, some within the community and some outside, to try to get objective information. You might submit a survey tool that you want somebody to look at and give you feedback on it. Is it right? Is it whatever?
you might get feedback from me.
Yep,
You
Holly's
might get
on
feedback
it.
from
She's
who
one
knows.
of our stars. So I feel like we're slow to the uptake on it. We need more of you to kind of start doing this. We've been doing it for a couple of years, and I put this on every single time I present. So there are flyers back there for you if you want to take.
Right. And there are also resources we have in the slide deck that you can talk to. And I would, for those of you everybody's got a college or university in their territory or their state that, go to the business school, go to the public policy school, the graduate schools for sociology and the like. They are looking for projects to do. They are your partner there. So if you don't have the resources at hand, go to the local universities, and they probably do.
Or give a call to the universities like an hour away or 2 hours away
Right.
or whatever, because this work can absolutely be done remotely. Some of it anyways.
Right.
data analysis piece.
So, anyway, that's it. Thank you to Holly and Kelly for their job. And have a great afternoon.